And as you can see on the screen here, the next agenda item is going to be regional breakout room presentations, which sounds very formal and intimidating, but really this is just meant to be a time and space for us to share some of the thoughts that we discussed in our individual breakout rooms. So we had our moderators who are leading the discussions with everyone within your specific region about, again, touching on things like what types of resources do you want to see from iHeart on a national scale? What types of resources do you want to see evolve in your region specifically? And also, how would you like to engage with your counterparts in other regions, as well as with your colleagues who fall within the same region as you in the iHeart map? So we would love to hear. I'm going to go ahead and stop screen sharing so we can all kind of feel like we're back in the room together. And if you're able to turn on your video, we do encourage you to please do that so that we can all feel like we're having this discussion in real time with each other. But essentially, we'd love to touch base with each of the breakout rooms that we just had so that you all have an opportunity to share some of the key points or maybe novel ideas that you were able to come up with during your session. So perhaps I will touch base with each of the moderators of the room, and you can let me know if the moderator would like to share those ideas, or if there was an appointed person in your group taking notes who'd like to share some of the key points. We'd love to hear from them. So how about we can start with maybe how about Northern Plains, which was Drew Babcock was our moderator, and I know Kirsten was hanging out in that room as well from our iHeart team.
We did not appoint anybody, but I think between myself and the rest of the folks in Northern Plains, we can get you situated, and especially Dr. Owens can too. But again, we kind of focused more in on the mentoring side, and what that would look like for the Northern Plains region specifically. Obviously, things that came out of it were sharing of programs, what programs work, what programs don't, connecting students to schools programs that would fit their needs, not just professionally, but also from a support/mentorship side. And then Reno brought up something that was really interesting because especially when we're dealing with minors and things, we all work at most of us work at institutions that have already done background checks on us. So using that in a sense to introduce others to communities and elders within those communities to form relationships, to gain trust and things like that. Let's see, identifying a state-by-state point person was also discussed, and newsletter. And I probably skipped over a bunch of important stuff, but
Drew, do you mind if I step
absolutely in? Go ahead.
Okay, Miigwech. Regarding the videos, that was a great idea from Reno, and thanks, Drew, you mentioned it. It's really for twofold. One, to let students know that we are a contact. So, and we'll to make it even more approachable by students. We're thinking about trying to find either an elder or a trusted member of a community to introduce the videos of each of us. So they would say, here's someone that I know who is involved in the school of dentistry. There's a good contact. Here's someone who's at the tribal college, and show them that video. And then if the student wanted to, they could get a hold of us. It's also, though, to introduce us to one another. We identified one of the problems with our region, and everybody's got the same problem of our region being so big. We don't know who one another is. So we're thinking about developing some sort of list, like maybe an internal contact list on our website. We don't know if that's possible. Izzy, I'll talk to you more about it after. where we can all connect and see each other and what schools we're part of. So if we have a student coming up in our region who's thinking about pharmacy school, I can look on there and say, oh, Drew, he's involved with pharmacy school. Let me connect my student with him, that kind of thing. We're also, during our regional meetings, we're planning on doing a better job of introducing and talking to each other about what we do so that we can kind of track that in our minds. Someone mentioned that and this is so true, there are lots of conferences like Toll in our group mentioned the Indigenous or Native Education Conference that happens in Chicago every year, but many of us don't even know about it. So wondering if we can't start listing the conferences on our newsletter every month. Speaking of our newsletter, we're wondering about highlighting to share news nationally about what we do. We're wondering about if we could either highlight each region or if each region could have a component, one block, say, of that newsletter and share what's been going on in their region. And then lastly, because we are so widespread and we want to share information about our programs, in our regional meetings, we're talking about focusing on a grade. Okay, who's got something for K through 12 in our region? And then everybody would talk about what they had for K through 12 for that meeting. It would be dedicated to K through 12, a junior high dedication, or undergrad dedication, and on and on and on. So that was Northern Plains. Miigwech.
Thank you. That's wonderful. A couple of the big points that I picked up on from that are number one, ways to connect us as a network, as a task force network better. So that can involve a newsletter, some kind of regular update that people will receive about what's happening with the other regions in IHEART, so they can potentially see areas for overlap and areas for collaboration. Also better understanding ourselves as a team. So what does everyone bring to the table individually, and what do our organizations bring to the table in terms of programming, so that again, we can better identify and match up point people with students and also maybe with each other. And then one of the other key things, like you had mentioned, the video. So maybe that can aid in that process, is having sort of like a video library of self-introductions, maybe, where people can submit a short, it could be a 2-minute video, perhaps, introducing yourself and maybe giving the elevator pitch for your programming that you work on, something of that, so that other people in the iHeart network can be introduced to you and know what kind of things you work on. So those are some of the key points I'm writing down from that.
Yeah, I want to emphasize that you can talk about your program, but it's also important that you talk about yourself as just a contact in general that's supporting students. Unless you don't want to be, then you might be in the wrong place today.
No, I think it's a good idea for community members and students to know more about you personally and like, where your heart is, and program third or fourth on the list.
And I think that that personal element is important when we're trying to appeal to young students and students who are really looking for an Indigenous mentor, Indigenous programming. Is I always tell students I'm a traditional dancer. And funny story on that, one time I was called out in the lineup for grand entry because a student wanted to ask me about how to apply for some financial aid. So that was interesting, when all the elders kind of lead in and then the young person comes and drags you out of line. But that's okay. I am that person 24/7. So anyway, my 2 bits.
Thank you. One other interesting point you briefly mentioned was the idea of having representatives, or at least points of contact, for each state. And I wonder if you could tell me a little bit more about how that came about.
Drew, I don't remember that. I think it's a brilliant idea, but I don't remember that point. So that's up to you.
I just mentioned it as like we were saying we want to be connected, but like it'd be really hard for me to know everything that's going on in Montana. But I feel like I could probably get you to a person in Minnesota pretty well at this point. So we were just sort of like, in each state, that might be the way to parse out who the point person might be.
And it sounds like you're saying it might not be a formal position or leadership responsibility, but more so get in touch with this person if you want to know more about who else is working in this state or what programs might exist.
Yeah, or Kirsten might have 10 contacts for a student, and I have none. So I would just say, Kirsten, hey, do you mind? And she would send out her web.
Mm-hmm.
That's exactly how I describe it. True. Thank you. My spider webs.
I was going to say tentacles, but that would have been really.
Both of those metaphors are a little unpleasant to think about, but I'll take it. Gets the point across.
All of the above.
Okay. All right. Well, for the sake of time, I think I'm going to shift us over to another regional group. How about our California group? I think Antoinette was moderating that one.
I was. We had a group of mostly new folks. So, we have folks who want to be involved but weren't there today. And that's okay. We keep it moving, right?
Mm-hmm.
I'm not sure how detailed. I'm going to do more of a summary. A lot of conversation focused on physician shortages and the issue of California natives going to out-of-state medical schools because they can't get in. And the prime programs hopefully are going to change that story. In addition, we have the post-bac program that's starting this year at Cal Poly Humboldt, and that is collaboration between UC Davis School of Medicine and Cal Poly Humboldt, led by myself and Dr. Cacciabaldi. So what we need to tackle is getting organized and being strategic. Because California is so long, it's about a 16-hour drive to go from one end to the other. So there are a lot of things we could do, but I try to hone in on what could we do that's focused and strategic for healthcare professions, not just physicians. And one, we talked about getting more data and, lining out where the shortages are in the different parts of California. But also the next one, which is the National Indian Education Association and the California Indian Education Association, which will always have an annual meeting in California. But this year, National NIEA, I'm going to just say, NIEA is meeting in Palm Springs in October. And the plan is to submit an abstract geared towards high school, college students to start thinking about health careers. I mean, we just got to start somewhere. And so taking a stab at that, and a few of us are going to work on that project. And then continue the work through the California Indian Education Group. Because they tap into all the schools with Native students, as well as the Johnson O'Malley programs. We still need to look at other strategies, but I think just getting up and running, that's going to be our first focus. The other part is supporting students on their pathway, whether it's into medicine or other careers, and looking at their needs, whether it's housing, finances, etc. Helping them to succeed. Yeah. And
I think you forgot the stakeholder development of the state and finding representatives from the region.
There we go.
You gleamed over that, but I thought that was really important part of our discussion.
Good job.
And what Mary said about getting a van and going from school to school, basically mirroring what Dr. McCabe said, go to where they are. So I think that was really important, what Mary said.
And I think that goes with doing it locally. you know, where we get in our car and go to the school. You know, we can't travel the whole state. We don't have that kind of funding, but we do have our own vehicle and our local schools where tribes and or the urban areas can be reached. So I think that sums it up overall. And that we now have an infrastructure to help out with getting regular meetings going. And so we'll lean on our fearless leader, Stephanie, for setting up the meetings so we can get this show on the road.
Wonderful. And just for everyone else's knowledge too, are you guys going to be using Zoom or Teams, just so we know what platforms are available out there?
Seems like Zoom would be the more user-friendly. I don't know. Everyone seems okay with Zoom, so stick with it. Dr. Kalak is still involved, but he had to take a few months off. Alec Kalak just finished his PhD, so now he's going into clinical, so we may not have his involvement, but we definitely have Dr. Nicole Stern, who's always doing the annual Accessing American Indians in Health Professions in California. So it is open to all students. So that should be advertised through the AAIP website.
Wonderful. Great. Well, thank you for the updates. I'm sorry, did you have another thing, Antoinette, you wanted to add?
One more thing, I just want to put it out there. The change in the framework for California Indians going to other states is partially changed because there are 2 prime programs allowing for 6 Native students to go through medical school each year. And that's a huge change for California. Never happened. And one's in San Diego, tied, and ours is at Davis School of Medicine in Sacramento. We also consider out-of-state Indians. So that's it. That's my ad.
Thanks, Antoinette. We appreciate it. All right, we're going to keep things moving along. How about our Southwest group? I think that was Dr. Begay.
Okay, and Judy is going to go ahead and give the report for us.
Sure.
Okay, hi. So can you hear me?
It's a little quiet, Judy.
Can you hear me better now?
Still kind of quiet.
Ooh, mine went bad. Still quiet?
Oh, it's getting better.
Okay. Maybe I got a better.
It might be your headset. Oh,
yeah. Is that better?
That's much better. Thank you.
Okay. So we talked about background with the Southwest region, that they meet every 3rd Tuesday of the month and trying to keep and maintain connectivity. And keeping track of Southwest specific pathway programs. We're excited about the IHEART database and the resource.
Did she freeze? She might be frozen. Yep. Can give her a second and see if it comes back in, but let's see.
Okay. This is Adrienne. I can go ahead and
sure, please.
So as far as how we can interact with other regions moving forward, of course, the Southwest region has been meeting every month on the 3rd Tuesday of the month, and we've done some work as far as getting our own Southwest region programs, trying to keep track of those. And so we're excited about the possibility of the GIS map. We're really happy to see Nevada here today. So we're going to rein Nevada in and keep them going. As far as one of the recommendations was for how do we engage with other regions? And we do have our monthly meetings, but maybe quarterly having regional representatives where we get together, where they get together and kind of do the collaboration and the sharing. So that was one good recommendation. As far as the support or engagement with our peers, I think a lot of the times it's just that sharing. And one of the things that we do during our monthly meetings is we have a sharing of what the different people who are participating, and then coming and sharing like what the programs are doing, and just catching up with each other, and just trying to keep our collaborations going. One of the items that was brought up was, since we do have the funding that we can be using for our regions, the recommendation of maybe webinars specific to like the Southwest region, and then also sharing that out with the other regions would be another thing that we could do. As far as challenges, representation, there's not enough Native sponsors or mentors for our students. And I think we talked about that before. And then also just the training of mentors. Unfortunately, Dr. McCabe was cut off at the very end of our talk. And so, that's a big thing, is training of mentors. Maybe we don't have enough Indigenous mentors, but even there are individuals who are non-Indigenous, but they have a passion for help, getting the workforce going, but then they need some training as far as working with Indigenous populations, really knowing specific historical context or about the population. And let me see. As far as one of the challenges that came up were somebody who is in a role as far as a program coordinator finds it sometimes difficult to have students, Native students, to come out of their shell. Maybe they're there for research or for a specific program, but they don't come forward and say that they're having difficulty, or the program that they're in isn't just what they envisioned it was going to be. And so they find it difficult and then end up maybe not doing well. But like how do we get our students, how do we engage our students so that they trust us, so that they trust the mentors that they have, so that we can help and step in sooner. So I think those are, I'm going to ask my group, is there anything that I missed? I think that's all we had. So thank you.
Great. Thank you so much. And that's a wonderful point that I think echoes what we said earlier about, needing to change or adapt our outreach efforts so that we are proactively finding students to offer help rather than passively waiting for them to come to us asking for support. All right, we'll keep things moving along. How about our East Coast Southern Plains group?
Sure. Hello, everybody. We didn't really pick anyone to speak. I didn't know if Kimberly or Norma or anyone else wants to speak, but I can go ahead and get started. As always, one of the biggest difficulties with the region on the East Coast and in the South is just one, it's just the expanse of the size. I mean, it's just so huge. But we also have schools that are in our areas that are in urban settings that have very limited, not only just Native populations, but Native students, and how we make them feel inclusive. One of the thoughts about that, and I think it was a wonderful idea, it was brought up before, but we didn't bring it up, was a newsletter for our individual region itself, but also too of trying to find mentors or maybe even community members from whatever nation the student is from that they can speak with or talk to. We may have students that are within different areas in the East or the South, but maybe from out West or Northwest or wherever they may be. And just, someone to speak with that is from their own community to help them feel more comfortable. We also talked about, which I think has already been discussed before, of some type of a data bank or repository for students who maybe are in a pathway program of how they can get to where they are in that pathway program, whether they're in high school or in college, and then moving on to, where they want to go next, and how iHeart can help with that. I think is so important for our region itself. Anyone else that was in the Eastern and Southern region have anything else to add?
I think similar to what Adrian was sharing about how to work with individuals maybe who are not native and how to support them in their professional development when they're working with students who are native. So maybe there is some kind of like webinar or workshop on providing culturally responsive mentoring or, culturally responsive programming for native students. And thinking about how we leverage the network to support one another, to support each other's programs as well. There was a mention of the importance of continued engagement and the voice of students in helping us understand the key issues, making sure that they're engaged as well. And there was a little bit of discussion about, back to what Brian was saying, in terms of you have students from different tribes, how you can basically foster like intertribal activities, how to bring students in so that they can build community, even if the person's not exactly identified with their specific tribe or community, and how to foster that through food, through sharing and other activities as well. I could say that for the East Coast region, as Brian mentioned, I think the challenge has been that many programs are dispersed and there's not like a same history of programs as there are in institutions, in the middle of the country, central and west. And so I think part of it is being able to build more of those connections between the various programs. And we have a monthly meeting, but it's been hasn't been well attended often. In the beginning we had maybe about almost 15, 20 people, and then in some cases we only have 3, but either way we still use the time to at least share and get to know each other and what we're trying to do. So I think part of it is beginning to build that infrastructure and active engagement, and think about what is it that people, basically leaders on the East Coast, need in order to kind of keep that engagement going.
Mm-hmm. Norma, I wanted to comment. This is Dr. Williams, and from California, but most of my education has been on the East Coast, Rutgers, Tufts. And I was working with UPenn students and Drexel this past few months. And I wanted to add those students. I've got 3 pre-meds right now at UPenn for you to reach out to. But the infrastructure is such that they have not seen us at all as compared to where Malvina's from in New Mexico and Navajo country, etc. So the issue is the paucity of Native people left as a result of what? The Dawes Act, when they relocated all the Native people right west of the Mississippi. So they either, I hate to say it, dead and part of the dust that we walk on in Philly, New York City, Manhattan, etc. But they do have ancestral ties. And AIP has had a couple of Delaware people that were in leadership and part of the founding members of AIP, just historically. Upstate New York has a lot more representation, working with the Catamongas and all the tribes of the state of New York. But as you know, as you get further to New York City and Philadelphia, et cetera, it just doesn't exist. And I don't know if you know of USET, if any of you all have worked with USET, United Southern Eastern Tribes portion of IHS. So that is another group to reach out to. The Seminole Tribe of Florida does not have a doctor yet, but they're interested in funding programs.
Hey,
So
Laura,
I would reach down if you wanted to.
sorry to interrupt, but we don't have much time left and we still have to cover Alaska. So for our regions.
Very good.
But Laura, thank you. I'll reach out to you.
Often. I'm not here very often because of my schedule. So I want to get it out there because I don't know when I'll be with them again.
Thank you.
But I'll definitely reach out, Laura, so we can talk more because it seems like you have a lot of good connections. And that's what this is about, right? Creating those connections. So thank you. I guess we'll pass it on to our next region, Alaska.
Thank you.
So I was the moderator, but I would like to introduce you to Kristen Ryle. Sorry if I'm not saying your name correctly, but she's from the University of Alaska Anchorage, and she's going to be our spokesperson.
It's Rial. You can remember it says y'all. I'm actually from the Southeast originally, so that's how I tell my students to remember it. I'm a member of the faculty of our psychology department here. We have a couple of programs that are geared towards supporting Alaska Native and American Indian individuals. So that's kind of my connection. I was also previously in I worked for Tribal Health up here. So some ideas that we talked about was a shared document, maybe like a Google Doc or something to list resources for Alaska and the Pacific Northwest. Looking at using, Alaska has a primary care network that's like a support network for primary care providers in the state, and trying to develop some connections with those to help us build and grow a network without necessarily having to build more infrastructure, just relying on their infrastructure to connect. So looking at things that we already have and trying to build upon those with the idea of building supports for Alaska Native and American Indian individuals who are pursuing careers in healthcare. Looking for maybe also setting up a database of research mentors that would be available for Alaska Native and American Indian students who are interested in working with an Indigenous mentor. And then also trying to figure out ways to support individuals who maybe have tuition support but are struggling to cover the other expenses of life. Like, yeah, your tuition's paid, but you still have to eat, you still have to, have somewhere to live, et cetera, et cetera. And especially when you have someone who's coming in from a remote community here, it can be quite difficult to adjust to life in Anchorage and to get used to all those expenses and living on your own. So also some skills that you would need if you had lived in a community of 300 people for most of your life, and all of a sudden we're in a city of 300,000. As far as ways that we wanted to engage, creating that resource repository or a resource request list can coincide nicely with the resource map that's being developed, or that could go in that, but that was something that we all. Sorry? Oh, okay. Looking for students to also access cultural support as they're pursuing their healthcare careers, to sort of allow them to not be as disconnected as you would be typically, especially, again, a lot of us are in Alaska. So it's very hard sometimes for people to stay connected with their home communities with limited internet connectivity and just the expense of traveling home in addition to rent and food. Looking at trying to develop more STEM-related activities for younger children. More information about partnerships and networking opportunities within our region. And we talked about setting up regularly scheduled meetings. That's not something we currently have. As far as the challenges we identified, the distance and connectivity, that's improved a lot with the availability of Starlink and satellite internet. The job aspirations versus job availability. So we have it was brought up that there are a lot of individuals in rural communities who would like to remain in their rural communities, but who want to do jobs that are maybe not necessarily available in those in the smaller villages. For example, I think a radiology technician, that job came up, and it may not, radiology might not be available in the individual's home community, and figuring out how to support them and sort of either finding a career that fits where they are, or finding a place that allows them to stay close enough to their community of origin while pursuing that career. And then talking about stepwise career development to meet familial obligations. So oftentimes, especially with those non-traditional students, they have other obligations and maybe can't go straight to their bachelor's degree, but looking at getting them those interim credentials so they can start earning more and start accessing those next levels of higher education. So sort of scaffolding the process of attaining a credential. And then sort of feeding into that, it also came up as maybe trying to figure out ways to get entry-level positions in healthcare seen more as traineeships instead of as just being those like that technician or that very, sort of entry-level provider, seeing that as, well, yes, you're this, but one day you're going to be that. So like you're a CNA right now or a community health aide, but we want to build you up to being a nurse, or we want to build you up to being whatever follows the individual's aspirations. I think I've summarized everything, but if I have left anything out, please interrupt, correct, add on. And it was really nice meeting everybody from up here.
Thank you so much, Kristen. That was a wonderful summary of so much that we covered in our breakout room. So thank you for doing that. And it's really exciting just to hear now each of you as a region have been able to think about your needs as a region and also your goals, what you hope to do collaboratively. And tomorrow we're going to get the opportunity to put you all in rooms with people from other regions, and you'll get to hear what they're doing. Maybe they have the solution to the challenge that you've identified already. So looking forward to doing more of that tomorrow. And now I'm going to hand it over to Dr. Norma Poole-Hunter, who's going to give us some brief closing remarks for today.
Thanks, Izzy, and thanks, everyone. This is really the beauty of iHeart and all of us coming together, sharing our experiences, our knowledge, and really seeking those solutions for systems change. So my goal today, right now, is just to give us an overview of the day. Also, I want to encourage you to vote if you haven't already. I know we have had some people who joined us midway. So Izzy, I don't know if you could maybe at least share. I think that's the highlight activity of today, aside from the breakout sessions and the student session, is to give you an opportunity to vote on the iHeart logo. And so it's the logo with different colors, schemes. And so if you haven't had a chance to, Izzy will drop it in the chat. Please make sure, thank you for showing it, so you could use the QR code or the link to be able to, I don't know if you could bring it back up. Yes, thank you. To be able to vote on what you prefer as the logo. And she just dropped the link in the chat. So that's one highlight for today. I think, for us, we talk a lot about engaging student voices, engaging the individuals who are along the continuum, who really want to achieve much of what many of us have achieved as professionals. And so what was really impactful is just hearing the voices of students and understanding that, unfortunately, many of the challenges are probably very similar to challenges that many of you experience as professionals. And so in many ways, it's very disheartening to hear. But also what we heard a lot was the importance of culture, of history, of traditions, and really strengthening individuals' resolve as they experience challenges along that pathway. And really helping us to maybe reflect a little bit about how do we leverage iHeart to meet those persistent challenges that students experience across the health professions, whether it was connecting to mentors, especially Indigenous mentors, Indigenous leaders and professionals who can serve as role models, being able to address some of the social determinants of education for many of our communities, whether it's childcare, and especially for non-traditional students, to be able to address issues of affordability, being able to identify opportunities for individuals to support themselves financially while they're achieving their goals, and basic foundational skills like study and learning skills that oftentimes don't exist in a lot of our K-12 systems in our high schools, to really help them be confident in their skills, but also competitive as applicants. I love I put some quotes. I pulled out some quotes from what some of them said in terms of, I don't want just an ally, but I want an accomplice in the work that what I'm trying to do and how I'm trying to be the change that I want to see in the world. And so really a lot of inspiring narratives and very transparent about the impact of not just education, and the resources that are available or not available, but also really looking at the historical traumas and how intergenerationally that impacts our families and our communities. So really taking a holistic view of the Native student experience in order to support them on their journeys. So we were very fortunate to hear their narratives, and if they're here, thank you again for sharing that. But again, emphasizing the importance of roots, culture, and healing as we move forward, really taking that holistic approach. We learned about some of the efforts that iHeart is undertaking. Not only are we kind of branding ourselves and ensuring that we have an understanding of our goals and initiatives, building a website, building communications tools like newsletters, but also building a resource bank for us so we can understand not only is what's happening within our region, but across the United States, to really have a repository, a one-stop shop of Native-focused programs. And so that's really critical for us. So if you just joined us, we have a link as well to be able to have you start inputting that information, because that's going to be a critical resource for us as we move forward. And then we just finished off our regional conversations. It was so critical with the vision of this work is not only to work across the nation, but also to really address the unique needs of our regions. And we know that there's challenges, whether it's based on just geographic chain differences, whether it's existing programs, the various communities and how well they're connected, but that we will really try to find approaches that are tailored by region, but also think about what are their kind of consistent themes and needs across the nation and see how we balance those as a community. And so we will be sharing notes from each of the regions. We are recording these sessions, so they'll be available for everyone after the summit. And so I just want to say thank you so much, for participating today, because your active engagement is really what's going to make a difference in terms of advancing systems change through iHeart. We look forward to seeing you and engaging with you tomorrow. We'll start again at 1 p.m. Central time, Eastern Standard Time, but 12 p.m. Central. So again, 12 p.m. Central, we'll join you. I keep thinking, where am I? What region? But we really look forward to seeing you. Make sure you vote. And if you know someone who wasn't able to join us, feel free to share the link so they could vote as well. Because again, iHeart is about this community and ensuring that your voice and that your engagement is part of this whole change. So thank you so much for joining us, and we'll see you tomorrow.